I'm Dr. Leo Galland. I'm an internist who practices in New York City, and I have a special interest in integrative therapies for patients with inflammatory bowel disease. The evidence comes from double-blind, placebo-controlled trials. For Crohn's disease, the best evidence is that diet is especially effective. For ulcerative colitis, the best evidence relates to probiotics, fish oils, and prebiotics. Not necessarily. The only probiotic that has been shown to help people with Crohn's disease in randomized clinical trials is a yeast called Saccharomyces boulardii. The studies on bacterial probiotics have been fairly disappointing, and in my own clinical experience, I've seen patients with Crohn's disease sometimes get worse from using probiotics like acidophilus. So I think those need to be used with caution. Actually, the data on diet and ulcerative colitis indicates that patients with ulcerative colitis are at greatest risk of relapse if they're in remission from the consumption of meat, from the consumption of oils that are vegetable oils that are rich in omega-6 fatty acids, or from alcohol. The SCD is an excellent first-line diet for Crohn's disease. It is not helpful for most patients with ulcerative colitis. And the SCD and the paleo diet have a great deal in common, so I put them in the same category. The diet that I use as a first-line approach for mild to moderate ulcerative colitis is actually a high-fiber, plant-based diet because the available data suggest benefit, but there are really very few controlled trials. Stress plays a role in aggravating the symptoms of inflammatory bowel disease and sometimes in actually causing relapses in patients who are in remission. And mind-body therapies are helpful for stress control. Acupuncture can be very helpful for pain. I wouldn't depend upon it for the treatment of inflammation. There's always a possibility for negative interactions between supplements and drugs, although there are also positive interactions. The major negative effects of natural therapies when they occur are through aggravation of the underlying inflammatory condition. I've seen this in both Crohn's and colitis. With treatment may help one patient, but it actually aggravates the symptoms of another. It's not a direct drug supplement interaction. The positive drug supplement interactions include the benefits of fish oil and folic acid and certain probiotics in conjunction with drugs like mesalamine, for example. Well, fermented foods, like any other food, may be helpful or may be harmful in patients with inflammatory bowel disease. You need to approach it as a kind of personal experience. The different fermented foods contain a variety of probiotics that are naturally present. They may be viable or they may no longer be viable. So there's not one general answer for that question. The studies on glutamine have shown basically no benefit in Crohn's disease, even though glutamine is very nourishing to the gut. And with regard to colitis, studies in experimental animals have actually shown that glutamine can aggravate experimental colitis. So I don't recommend glutamine in the treatment of IBD. With regard to colostrum, there just is insufficient data. There are growth factors in colostrum that might be helpful in healing Crohn's disease. Cannabis is basically a drug, and I don't quite put it in the category of a natural therapy. But there was a recent study indicating that it was helpful not only for symptoms but for disease activity. Vitamin D, on the other hand, has is of demonstrated importance in the prevention and the treatment of Crohn's disease, and I think is probably the most important single nutritional supplement for patients with Crohn's or at risk of developing Crohn's. Zinc may also be very important for Crohn's disease. It enhances healing and immune function and is frequently deficient. Patients who are using 5-ASA derivatives like mesalamine may be deficient in folic acid because they can interfere with the absorption of folates, and folates and related B vitamins tend to be important for patients with Crohn's disease. Well, the studies with fecal transplants have shown kind of mixed results. They're all preliminary. Children may respond better than adults, and that's something that is really only being done on a research basis today. We'll see what the future brings for that. The pig poop pill, which is worm therapy, it's Trichuris suis ova, or TSO, is also an experimental therapy that is presently being studied in the U.S. in clinical trials and has been studied in clinical trials before. There have been some promising results both in Crohn's and ulcerative colitis, and it seems to work as an immune modulator, decreasing the tendency towards inflammation in the gut. Well, the role of bacteria in inflammatory bowel disease is very complicated. There's no bacteria that is the primary cause of either Crohn's or colitis that's been identified, but normal gut bacteria can amplify inflammation, and inflammation itself causes changes in the gut bacteria, producing a type of bacterial composition that's more pro-inflammatory. So it's a kind of a vicious cycle. The diet that attempts to address some of these bacterial imbalances is the specific carbohydrate diet. And it certainly works for a lot of patients, especially with Crohn's disease. Whether it's working through that mechanism or not just isn't clear. A high-fiber plant-based diet will also have an impact on the bacterial composition of the intestine, which may be one of the reasons why it's helpful for ulcerative colitis. There's a particular group of bacteria which produce substances called sulfides that seem to play an important role in Crohn's and colitis, and more research is needed on the effects of diet in controlling sulfide production by bacteria. In general, let me say that high-protein diets increase sulfide production, which is a reason to consider a plant-based alternative, at least in ulcerative colitis. Well, integrative medicine is not a single discipline. It involves the interactions of multiple disciplines, so there's no set of credentialing criteria, and you can't just go out and look for an integrative practitioner. Recommendations are the first step, however, and I think you should decide what modalities you're interested in. Is it nutrition? Is it acupuncture? Start by talking to your doctor. Also talk to other members of your local CCFA group to see who's good, who gets good results. Then check out the credentials that this person has. In general, I would favor someone with a medical or osteopathic degree because DOs and MDs are going to have a better appreciation for the seriousness of IBD. I would avoid people who have a set protocol, and I would definitely interview the individual, find out how experienced they are in dealing with people who have Crohn's disease, and do they individualize therapies? I would use caution with people who have a one-size-fits-all protocol, because not only are Crohn's and colitis very different in the way they respond to natural therapies, but within each diagnostic category, one individual can respond very differently from another. There simply is no one protocol that's right for everybody.